This
Welcome
conference
everyone
will now
to
be
our
recorded.
monthly.
This conference will now be recorded.
Oh my, lots of recording and
Sorry,
unrecording.
sorry, go
No
ahead.
worries, Josh. Yeah, welcome everyone to our April PI coordinator call. Next slide. And we are sort of midway through our years that run from October to October. So this is just a good opportunity to thank all of you and all of your sites for your ongoing commitment to this project and for making it a success and for joining our call this morning. And it's because of this commitment that we are going to not only answer a critically important clinical question in the field, but also demonstrate the power of Improved Care Now as a learning health system, being able to propose a question of high value, being able to answer that question of high value, and subsequently being able to implement the learnings back into practice. Next slide. Our agenda for this morning, a few announcements. We'll talk about some missing data. And we're going to play a game called Name That Outcome. And we're going to skip the Cards Against Combine that was done at the face-to-face lunch session over the weekend. And hopefully there might be a few minutes at the end for questions and discussion. Next slide. We can skip this one. Next slide. So just a little bit of overview, kind of high-level overview as to where we're at. We have enrolled a total of 217 participants. This slide is a week or two out of date. Of those 217 participants, most of them are still in follow-up. About 140 are active in follow-up and on study drug. About 50 are active in follow-up but off study drug. For one reason or another, most of those have met a primary endpoint. 22 patients have been early terminated for one reason or another. Either they withdrew or were lost to follow-up. And 4 patients so far have completed the 2 years of follow-up. Next slide. And keep going. So this is just a reminder that recruitment is really just the beginning in the long journey of Combine. We have a follow-up period that will range from 1 to 3 years, as mentioned during the last call. And we expect for clinical care, given that this is a high-risk population and a high-risk treatment, anti-TNF, that the close and frequent follow-up is needed. We have stated a minimum follow-up in our protocol at week 4, week 14, week 26, and quarterly thereafter. So sort of frequently in the beginning to make sure that the patients are doing well on their anti-TNF and tolerating both that and study medication safely, and then sort of more spaced out follow-up for the rest of the study, again, just to monitor for safety and clinical response and growth and nutrition and all of those things that are so important in IBD care. And we expect that for Combine, that follow-up is nested sort of in routine care. We understand that there may be some good reasons why patients aren't seen at one or more of the suggested timeframes. That's okay. It's a minor protocol deviation. We expect it, no biggie. We also know that some patients are seen more frequently than our Combine study visits, and we need Combine and ICN registry data collected at all of these visits, not just the minimum visits that are stated in the protocol. Next slide. So this is sort of an overview of how we are doing with getting patients seen during these suggested timeframes and getting data entered into both the registry as well as the Combine. And you can see sort of across all of our visits, we're batting about 80% or so. And that's sort of what we had expected, and I think we're okay with that, given that this is a pragmatic trial. I would love if this were a little closer to 90%, but 80% is okay. And one thing I think that's really important as we look through this is, we're not seeing 100% at screening and 90% at week 2 and 85% at visit 3, and it's not sort of trailing off. And so what that means is that if a patient skips, for example, visit 7, we may get them at visit 8, or if they skip visit 8, we may get them at visit 9. So we're not having that many patients that are completely lost to what the follow-up. They may skip a visit intermittently, and we'll get them in for the next. Next slide. So there are a number of consequences of missed visits, which is why it's really important to do everything we can to get patients in for their visits according to the visit schedule, and get the data entered into the registry. First is that patients who are on study drug who have not had a combined visit in 6 months will have their study medication automatically stopped by the pharmacy. So essentially, as we're into that follow-up period, we have quarterly visits planned. If a patient skips 1 visit, that's okay. If they skip the second visit, then their study drug is held, which is really unfortunate. We have built that in as a safety check for patients who are totally lost to follow-up from your sites. We don't want the study pharmacy to be mailing them medication. But we do want to be providing study medication to all patients who are actively followed at your center. So try to get them in at their scheduled visits. If not, then for sure don't miss 2 visits. Otherwise, their study drug will be stopped. Secondly is that each visit is an opportunity to assess and document primary endpoints, concomitant medication use, adverse events, serious adverse events, record lab tests and other crucial data, growth data, what have you. So we really do need patients to come in when possible during the visit schedule. The other thing that I forgot to put on here is that we pay you according to the visit schedule. And so if you skip a visit, we can't pay you for that visit. We're budgeted to pay you. We would love to pay you. So please get your patients in so that we can pay you. And finally, missed visits need to be documented on your deviation logs. So if you get the patient in, it's less busy work on the deviation log side of things. Next slide. Data completeness, again, as we are getting patients in for visits, we also want to make sure that we get their data checked, especially if it's a lab test and or a growth parameter, a height, a weight, whatnot. We want to get that checked, and we want to get it entered into the Combine and the ICN registry databases. And so this shows how we're doing with respect to collecting each data element. And we're by and large doing okay-ish. And I've highlighted in yellow a lot of the things that we're not doing so well. And importantly, a lot of the highlighted items come from that ICN registry. Again, Combine is an add-on to the ICN registry, and so we need both the Combine forms and the registry forms completed for each patient at each visit, both at screening and at subsequent visits. Next slide. And so how to fix the data that's missing. I suspect that most of the docs are ordering most of the labs for routine care. So first and foremost, if you can, enter the combined data as well as the data in the registry form. If for some reason your site is not doing a registry visit for that day, then there's the Combine supplemental data form. A screenshot of that is shown here. If you're doing the registry, at the top of that screenshot, just click the yes, I will skip this section. If your site is not entering a registry visit, then you can complete the questions below to enter the data that would otherwise be collected in the registry. This is retroactive, and so you can go back to the beginning of follow-up for your very first patient, and for all of those missed registry visits, either enter the registry visit or go ahead and enter this field in the Combine database. Next slide. All right, what happens if the patient misses the last and final study visit? And we do have a number of patients who are closing in on that last visit if they were consented as part of the 2-year follow-up protocol and don't want to continue for that optional 3rd year. So if a patient comes in, reasonably close to the final study visit, but maybe or say 6 weeks late or even up to 8 weeks late, even though it's a late visit, just count it as the last study visit, log the fact that it was late as a visit deviation, mark the patient as complete, and we will still be able to pay you for that final study visit. Here is the screenshot for the completion early termination form, and as shown here, highlighted in red, mark that patient as completed even though they were a little bit late for their final study visit. That's okay. Next slide. There are some patients who are part of the practice. They haven't left the practice, but for some sort of reason, they're just not coming in. They didn't come in for their final study visit during window. They haven't come in for their final study visit close to the study window. So here's what you can do. Call and talk to the family. Probably best for the clinician or a nurse as well as the coordinator to call and talk to the family. Confirm and record whether the patient has met any study endpoints. Do whatever you can by telephone, email the PRO forms, all that kind of stuff, and mark that patient as complete. Next slide. And what to do if the patient is truly lost to follow-up. You know that they've moved out of town. They're just not returning any of your phone calls. No matter what you do, they're just not going to come in. So complete the early termination form and use the date of early termination as the date of last contact that your site has had with the patient, whether it was a phone contact or a clinic visit, where your site knows with confidence whether or not the patient met a study endpoint. So if I have a patient who's lost to follow-up, but I was last in touch with them right after the new year, say January 5th. I knew the patient was doing great on January 5th. They hadn't met any endpoints. They weren't on steroids. They didn't have hospitalization, surgery. They were in remission, all that kind of stuff. Then I would say they were lost to follow-up on January 5th, and I would complete the early termination form as of January 5th. If I knew that they met an outcome, I would make sure that the dates and all of those outcomes were recorded. Next slide. So here's what we need to do at that last visit. Again, this is for patients who have not agreed to continue for the optional follow-up, and they're sort of completing their study at the end of 2 years. So complete visit 10, week 104, complete that data entry into the CRF, including the provider review, discontinue all study medications using the dose change form, and on the completion or early termination tab that we were just looking at, change the patient's status to patient completed the study and sign off on that form. And then and we know that that patient is done with follow-up. And if all of that works as planned, you'll get your scheduled unblinding for that patient. Next slide. All right, Anne, I think I'm going to turn it over to you for the second half of our call this morning.
Okay, good morning, everyone. So now we're going to talk about the endpoints or the outcomes of the study. It's one of the most important facts of the reason why we're doing this in this part of the analysis. So as you know, I'm going to go over what these endpoints are. We have the failure to complete a steroid taper by week 16. And then alternately, we have the use of steroids for more than 10 weeks, that's 70 days, cumulatively beyond week 16. There's a failure to achieve remission, and remission is categorized as an SBC SPCD-AA less than 15 by the week 26 visit, or an SPCD-AI greater than 15, which indicates active disease, at 2 or more consecutive visits beyond week 26 visit. Now, please remember this does not include the week 26 visit. It's for 2 or more consecutive visits beyond that week 26. Another endpoint is hospitalization for active IBD or abdominal surgery after week 26, or discontinuation of the anti-TNF agent and or the study drug for lack of effectiveness or toxicity. So this breaks down into 4 different endpoints, and you can choose which one absolutely applies. Next slide. Okay, many of you have already seen the outcome verification form that's been coming through, but this combine is a time to event analysis. So it's really important that we need a precise date for the first endpoint each patient meets. And then for each patient who meets an outcome, we'll work with you to complete the outcome verification form. So we will need the first outcome that's met. It could be 1 or more, the date that it was met, and then we'll work with you to clean up all the data so that everything matches in the database and the provider review, and everything is nice and neat. Now, the next slide, please. On this outcome certification form that you're seeing here, you're going to find this on the SharePoint site, and you can fill it out. You can download it, fill it out, and send it to me as soon as you know that a patient has met an outcome. Or alternately, I'm going to be completing the form and sending it to your site once I see that an outcome has been met. If you get the form from me, please verify that the information that I put on the form is correct, that the dates are correct. All I'm seeing is what is in the database, but you have the patient records and you know the history of your patient. So please feel free to make sure that all of the dates and the outcomes are correct and match your records. Go ahead, sign and date it, and you'll send it back to me. Next slide. Okay, now we're going to have a little bit of fun here called Name That Outcome. And what I'd like for you to do is I'm going to present some scenarios, and I'd like for you to think about whether this is an outcome or not. And I'd like for you to type it into the chat box there, your answer, whether it's a yes or a no. So next slide. Okay, patient number 1 reports abdominal pain, nocturnal diarrhea. He has no limitation on activities, however, but he does have some occasional abdominal tenderness. The SPCD-AI is noted here for visits 2 through 5. And of note is that the physician didn't feel that the patient was in remission. Next slide. Did the patient meet an endpoint? What does everyone think? Go ahead and type it in to the chat box, please. I actually minimized my chat box, so I can't see it anymore. Here it is. We have a couple of no's. Everyone else, what do you think? Yes or no? Did this patient meet an outcome?
Can you go back to the prior slide, Ann?
Yep. So we're going to be focusing in on that SPCD-AI, and let's go ahead and go to the answer. So yes, this patient did meet an outcome. And let's go ahead to the next slide. Which one? So we have two to choose from. We are looking at the failure to achieve remission by the week 26 visit. And why is that? Okay, is there one more slide? Okay, so what we're looking at here is that they did not have an STCBAI under 15 by week 26. So we have visit 2 was a 35, visit 3 was a 20, visit 4 was a 40. So they failed, they met that endpoint. And the date of the outcome was the visit date of the week 26 visit. Okay, next one. Okay, the next patient reports occasional abdominal pain, occasional to frequent limitation of activities, and occasional 2 to 5 liquid stool. Again, we are looking here at the STCBAI. And of note is, does the physician feel that the patient is in remission? So if they are under 15, then the provider does not need to answer that question. If they are over 15, then the doctor gets to overrule on whether if they feel that the patient is in remission. So they can answer either yes or no to that question. So what does everyone think? Did the patient meet an outcome? Type it into the chat box, please. Let's see what we have. Looks good. We're seeing some no's. Let's go ahead and see. Next slide. Did the patient meet an outcome? And no. So go ahead. And why? So again, we're looking at, did they, was it under 15 before week 26, or was it over 15 at 2 or more consecutive visits beyond week 26? Next slide. Okay, so it does not meet the under 15 by week 26 because they, sorry, another call coming in. So they were in remission on visit 2, where we have an SPCBA of 10, and also visit 4 of week 26, where it was 0. So in order to meet this outcome, they must not have met under 15 at any of those visits. So therefore, it did not meet that one. So it also did not meet STCBI over 15 at 2 or more consecutive visits beyond week 26, even though they have a 35 and a 20 for visits 5 and 6. Provider felt that the patient was in remission. So if the doctor feels that they're in remission, then they did not meet that outcome. So as a reminder, the elevated STCBAI over 15 due to a non-IBD reason, that could be infection, IBS, the patient may have had a normal colonoscopy, this does not count towards this outcome. Next slide. Okay. Our next patient was anxious about study drug side effects and stopped medication early. Now, this is a patient stopping the drug. This was not the provider deciding that they had side effects. So the randomization date was in January of 2018, and the patient stopped taking study medication in May of 2018, which was 17 weeks and 5 days after randomization. So this patient is off study medication, but we will continue to follow them as we would with all patients for the full 2 years. And we are going to report any outcomes, whether the medications, we will continue to report the outcome. So this patient was hospitalized on January of 2019, about a year after randomization, for abdominal surgery. Did the patient meet an outcome? What does everyone think? Yes or no? Did the patient meet an outcome? Next slide. We are getting lots of yeses on this one. Go ahead, let's see what the answer is. Which one? This is hospitalization for active IBD or abdominal surgery after week 26. What is the date of the outcome? And that is going to be the admission date of the hospitalization. So this is my favorite outcomes because it is so very easy to track. And this is one that as all the sites, if you know of a patient that is hospitalized for active IBD or is hospitalized for abdominal surgery after week 26, go ahead, fill out this form, put in the dates, send it to me, and we can mark the patient as having an outcome. So I'm actually going to stop on this slide because we are almost at 7:30. And does anyone have any questions at all?
And it's Mike. I just want to re-emphasize the fact that in this case, even though the patient stopped study drug because they were anxious or whatever, doesn't impact the fact that they still met this outcome on this date. Because it was a intent to treat type study. If the provider stopped the study drug because the provider thought that there was significant side effects, the patient would have met the outcome of provider stopping study drug at the date that that was previously mentioned. But I think in this case, it's because the patient sort of stopped on his or her own or at the parent's preference. We continue to follow them until they meet a second outcome.
Great. Any questions? Any other, do we want to have a discussion? What's everyone thinking? Okay.
Quiet group. You know, I think if anyone has some extra time and wants to stay, Anne has a couple more cases that she can go through, but we definitely want to be respectful of your time and not go over. But Anne, you can continue until I guess folks drop off if you want.
Sure. Okay, scenario 4. Patient 4 is use of steroids occasionally throughout the treatment. This patient was randomized in April of 2018, and the week 16 date was August of 2018. Okay, here are the start and stop dates of the steroid use. Did the patient meet an outcome? Yes or no? Next slide. What's everyone think? Let's go ahead to the next one. No, the patient did not meet an outcome. And let's talk you through why. So, of course, we're looking at the steroid taper, either by week 16 or the use of steroids for more than 10 weeks cumulatively beyond week 16. Next up, So this does not meet the failure to complete a steroid taper by week 16, because the week 16 date is August of 2018. And as you can see, they stopped the steroids by July of 2018, on July 5th, 2018. So they were off the steroids by the week 16 date. So they did not, they managed to complete that steroid taper. So it does not meet this outcome. Let's look at the next one. They did not meet the use of steroids for more than 10 weeks cumulatively. So I think of it as 70 days, not 10 weeks, because so any 70 days beyond week 16. So what we have here is 67 days of steroid use. So they have not yet met 70 days of steroid use. So they did not meet that outcome yet. Next slide. Let's see if they started another round of steroids. So they are now 90 days. Did they meet the outcome? I would say yes, they did. Next slide. So they have now used steroids for more than 70 days beyond week 16, and the outcome date is going to be the 70th day of the steroid use. So this is a calculated date. We're not going by visits, the study visit date. We can calculate this, and the outcome happens on the 70th day of steroid use after week 16. Next slide. Okay, the final scenario here is this patient started on adalimumab, and then the doctor decided that they weren't responding as well as they felt that they should. So the doctor switched them over to infliximab. Did the patient meet an outcome? So what's everyone think? Yes or no? We have a no. Let's go to the next slide.
Could you go back to the list of outcomes? Maybe 10 slides before?
Yeah, Josh, can you do that?
The outcome definitions, just to stare at them for a bit. Perfect. Nope. There you go. And so I think it's the last one on the list that this case is approximating.
That is right. The discontinuation of the anti-TNF agents for lack of effectiveness. And the endpoint, or what's the date of this endpoint going to be? And that is also a relatively easy one. The date is going to be the date that it's going to be the visit date of when the doctor decided that the anti-TNF was not effective. So the doctor or provider at any time can decide that the anti-TNF was not effective, or if there were some sort of toxicity issues, or maybe they felt the study drug was not effective, or that there were some toxicity issues with that. So that is the date that the provider decides that it's either not effective or that there's toxicity. I think that was the end of those questions there. So thank you for staying with us for a little bit longer here to go through these. Again, email me if you ever have any questions about outcomes. If you're wondering if your patient may have met one, go ahead and email or call and we can talk you through it. and also grab that outcome certification form and sign off that and be proactive in sending those as soon as you know that any of your patients met an outcome. So thank you for joining us this morning.
And Ann and I can stay on for a minute or two if any of you have questions or things you want to discuss. Otherwise, we'll talk to you next month.